Good morning. Welcome to Conversations with Carla. Today is Monday, June 8th, 2020. Good morning. I am Carla Harris, and this is Conversations with Carla. If you've been following us, we have been talking about returning to work as communities and cities and states are reopening after COVID-19. And today is our third and final series in Returning to Work, Are We Ready? And today we're going to discuss the mental health impact of COVID-19. And today, I invite you, as always, to join the conversation with your comments. We are live on Facebook and on YouTube. And I just welcome everyone to be a part of this conversation. Today, my guest is Dr. Edwina Bell. She is a licensed psychologist. She received her doctoral degree in clinical psychology from Nova Southeastern University. She completed her internship at the University of Miami Counseling Center and her postdoctoral residency at the Dependency Court Intervention Program for Family Violence in Miami-Dade County, Florida. She is currently the CEO and president of Bell Psychological Services, and I would like you all to help me welcome Dr. Edwina Bell. Good morning, Dr. Bell. How are you?
Doing well. Good morning, Carla. Hope the same for you.
Absolutely, absolutely. Well, thank you so much for being a guest on Conversations with Carla about this conversation that we really need to have. And, you know, talking about mental health is always important, but especially during times like this, we really need to just look at the impact of how people are feeling as we return to work after something we never thought would be a part of our community. And before we get started, I took a look at a Kaiser Family Foundation poll. And it was interesting, 45% of adults in the US feel that their mental health has been negatively impacted as a result of COVID-19. And of that percentage, interestingly, 47% of those who have sheltered in place feel more of a negative impact than 37% of those who have not sheltered in place. So just what has this time done to our emotional health, our mental health? Can you just talk with us about that a little bit?
Absolutely. A very good question, Carla. So what we do know is, according to the CDC, for example, as of this past Friday, the U.S. death toll as it relates to COVID-19 had reached 108,000.
Wow.
What we do know is that, individuals and families are grieving in isolation. What we do know is that over 40 million Americans have lost jobs. We also know that there is a rise in terms of domestic violence. And what also makes it significantly challenging is now, on top of COVID-19 pandemic, we have a racism pandemic. And we're dealing with, we're revisiting the police brutality against people of color. And so these are unprecedented times. I know you've heard that over and over. During this pandemic, it's unprecedented. And I would agree that the people's mental health has been challenged, it's been compromised, and it's been impacted adversely.
Mm-hmm. So, in doing a little bit of research, let's talk a little bit about domestic violence, which I discovered is clinically referred to as intimate partner violence. So, first of all, is there a difference, and why the difference in terminology?
Right. So basically, domestic violence is the same as intimate partner violence. And as it relates, so they're one and the same. As it relates to it, I mentioned that there is a rise in terms of intimate partner violence during this time, during this pandemic. And what we know is that 1 in 3 women and 1 in 4 men will experience domestic violence at some point in their lives. What makes it very challenging now during a pandemic, we're asking people to stay at home, to stay safe, and the place in which they're trying to stay safe is actually unsafe. So you have, during the pandemic and isolation, you have individuals that are extremely stressed. So they're stressed within the home. You have, I heard where there's an increase in alcohol consumption. There are more gun sales. And so being in homes that are unsafe with this significant stress, it does result in an increase in domestic violence. And then you have little to no resources to access during the time.
Hmm. Yeah, I tell you, it's really sad to hear that what should be a safe haven is not,
Yes.
especially during times like this. So let me ask you this. So going back to that Kaiser family poll, it's so we talked about people who are not sheltering in place. So I'm going to make an assumption that those are for folks who are going back to work or who have not had to stop working during this time, those essential workers and things like that. So do you believe that people who are able to get out and about have had less of an impact? And then what about those who are still sheltering but are working remotely? Do you think that there's a difference?
Well, the pandemic has brought on a great deal of uncertainty. And because of it, there's a great deal of anxiety. That's a lot of what we're dealing with in terms of clinicians right now. And so you're right, there have been individuals who have not had the opportunity to stay at home, who've been on the front lines. And with that, there's a lot of anxiety. Some people just don't have a choice to stay home. Within my practice, we've been fortunate enough to have telehealth where we've transitioned from our office, it was mid-March until now. But I would imagine being out there, you're concerned about whether or not you're going to catch the virus, bring it home, and maybe you're living with elderly people who are at risk. They're the at-risk population. So there is a lot of anxiety, whether you're at home dealing with it and whether or not you're out in the public.
Hmm. So I want to welcome all of you for our to join us with questions and just quickly to say good morning. So we have Marty Soroka is joining us live from Facebook. Karen Pfeffer, good morning to all of you. We have New Day Consulting, Kim over there on YouTube. So please know that Dr. Bell would love to answer your questions. So Dr. Bell, what so we know we have to go back to work.
Yes.
We know that we have to, we can't stay at home. We know there's no vaccine. We know that employers are taking precautions to make sure that they're either staggering their staff return or putting in sanitizing stations, things like that. How are we really feeling though about moving back into a place when there's no vaccine, where, if we really need the money and we don't necessarily have the ability to say, you know what, I don't feel comfortable. We know that legislation is also looking at not allowing or not holding employers accountable if someone gets sick and not being able to use their insurance for such. So, but from a mental health and emotional standpoint, what does that do to us?
That's a good question. And I think it brings on a lot of anxiety. And we have to be mindful, especially as employers, that everyone has been changed by this pandemic to a certain extent. It varies. And we have to, as employers, um, be open to the discussion of mental health. It has to be an integral part of your organization and your company. You have those individuals who, prior to COVID-19, suffered from clinical depression and anxiety. And during this time, they're still suffering. There's been a lot of loss on so many levels. And entering and transitioning back to work, you'll likely be experiencing these disorders. And so I challenge employers at this time to have an open discussion about mental health issues and to offer, there's this great program in terms of, it's called the Employee Assistance Program, EAP.
Mm-hmm.
And employers have the opportunity to offer that to their employees. It's a voluntary service, but many employees take advantage of it. It gives free sessions, say 3 to 6 free sessions, where you have someone to talk to. And I would also say that for employers, put your oxygen mask on as well. Put your oxygen mask on first. It's important that as you bring employees back to work, that you are cognizant and aware of the impact that this has had on you as well. And if you have managers, there's trainings that you can have within your organization as it relates to stress management. But just overall, make sure that you are incorporating mental wellness and having that conversation within your organization.
Okay, that's great information. So we have a couple of questions here. So let's go to Karen. So Karen says, what are the signs or what signs we can be aware of to recognize someone who may need assistance?
That is a very good question, Karen. And so, for example, so during this time, let me just normalize it and say that because of all of what we talked about, the high rate in terms of domestic violence and the death toll, there is anxiety, and that's absolutely normal, right? For anyone to experience anxiety at this time. When it becomes a problem and when you know that someone might need assistance, is if it's really impacting their day-to-day functioning, and if it starts to impact relationships, as well as the work productivity, for example. And one of the interesting things in terms of depression, a part of treatment sometimes is to have people get out and to socialize. And of course, because of the pandemic, a person has to stay at home. So it might seem like, they're withdrawn, but again, you're at home. So I would always say, when in doubt, definitely get checked out.
Mm-hmm, mm-hmm. So let's go back to the employers for a second. What are some of the signs an employer or coworkers should look for regarding emotional impact as their team members, teammates return to work? Are there some specific things that people can look for?
So there might be a decrease in productivity. You might find that the individual might be absent more than usual. The person might have significant difficulty interacting with their employees, with their employers. So these are some of the signs to look for. And you might even notice that individuals might have concerns about possibly abusing substances and alcohol. So these are some of the signs to look for.
Okay, good. Another question. So we have Kim who's watching us from our YouTube channel. What are your suggestions for people dealing with a form of PTSD during this chaotic time? Of course, therapy, but is there anything else? And just, do you believe that this would be classified as PTSD during, this time of this pandemic?
Right. And so not everyone who goes through this pandemic, who experiences trauma, for example, will necessarily result in a diagnosis of PTSD. Again, so just because someone who has experienced trauma doesn't necessarily mean that will develop into post-traumatic stress disorder. But the question is, What are some suggestions in dealing with PTSD? And I would say if it is truly PTSD, then the person does need to seek mental health treatment. And sometimes with that treatment, depending on the severity, an individual might need to be seen by a psychiatrist for possible medication.
Okay, good to know. Good to know. Angelique asked her question, and she says, "Are there any signs during conversations?" So let's start from the beginning. When we speak to the people we know but are unaware that they have a mental illness, are there any signs during a conversation that they would be able to notice, or questions about how they can ask? She can ask about how they're really doing.
Right. And so that's a good question because sometimes individuals who might be experiencing mental health issues might be able to contain it in a sense. And, they're going throughout their day, they're working, and everything is seemingly going well, but inside they're suffering. So, during this time, it's as we say, and we've reiterated, it's very important that you stay connected. And in terms of signs, just kind of have a conversation. How are you doing? These are some really tough times. How are you doing with it? How are you sleeping? How are you eating? And especially those people who you talk with on a consistent basis, if you haven't heard from them in a while, this might be a sign. So be sure to have these conversations just to check in on a regular basis with individuals to ask how they're doing.
What are some of the ways that we can, even in our own homes, what are some of the ways that we can gain a sense of balance and harmony within our time of isolation?
And that's a good question. Within our homes, we can try to maintain as much of a schedule as possible. What I'm finding is things have slowed down in a sense. And now we have the opportunity to really engage with each other. We have an opportunity to talk about these issues, especially with our children at their level in terms of what's going on. We have an opportunity to eat dinner together. A lot of times we eat and we have conversations about what's going on. So be very intentional during this time prior to going back to work that you do take advantage of the opportunity to connect with those within your home and to spend time together. Within the neighborhood, I've seen a lot of people during this pandemic who are actually out. I've never seen before, but everyone tends to be out. They're exercising, they're walking. So this is a good thing.
Yeah, absolutely. So you mentioned talking to our children. So I
Yes.
have a teenager, and I think that our children have become so desensitized about certain things, just by TV, social media.
Mhm.
Um, but we've never had in our lifetime this kind of pandemic. And then to compound that with the racism and the protest, what is the best way to talk to our children?
And that is a very good question. Again, it depends on the age of the child. You mentioned that, you have a teenager at home. And so with teenagers, the conversation will likely be more engaging. And so we know that with social media, the children are on social media. The younger kids, obviously, you want to limit their time on social media. But with teenagers, for example, you can have open conversations and talk about race relations and the protests. What do you know about the protests? What do you think about it? This happened. What would you do in this situation? So be very honest. And again, I would say that as parents, we need to put our oxygen mask on first. In other words, we need to know where we stand as it relates to the pandemic and race relations and all that's going on in terms of protests and police brutality. Understand where we are first, and because kids do pick up on what we're experiencing emotionally.
I agree completely. And I know, sometimes teenagers really shut down especially just part of being a teenager. They don't typically
Sure.
want to have engaging conversations with their parents. And I think that, during this time of quarantine, it can be really challenging overall, right? First of all,
Yes.
just because of what
Yes.
it is. And then when you couple that with you have a lot of single parent
Yes.
households. So not only do you have the issue of the stress of not working, but when you're a single parent and the children really have no other outlet, the parent has no other outlet, that can be really, really challenging. So, what would you say to those single parents out there about how to best work through this time when it's just you and the kid, um, in four walls? Those four walls begin
Sure.
closing in.
Sure. I would say that, within the four walls, you still need to access your support system outside of the home. Whether or not you're having a rough day, things aren't working out the way you wish they would, reaching out is definitely, whether that's a phone call, whether that is walking up the street, talking with a neighbor who might be a friend. I would definitely say get outside within your area if you can. Outside, especially here in South Florida, it does wonders for us in terms of the sun and the vitamin D, in terms of improving mood. But I would say you must stay connected. And I would imagine you have at least one person that you can connect with during this time. And especially as parents, the stress that we're experiencing, let alone being single parents, it's important that we do take time away, within our own homes. Step away and take the time that you need to regroup and to do those things that you do to engage in self care and taking care of yourself.
Hmm. And I've also, Dr. Bell, realized that even my daughter needs time away.
Yes.
And she's not as forthcoming with saying, "Mom, I need to just spend the day in my room because I just need to be away by myself."
Yes.
Um, but I've learned over these, 12 weeks or so that we've been, that those are the nuances that I've been able to pick up on when I know she needs to just sort of
Sure.
do her own thing, and allowing her to do that. We
Yes.
have another question or comment from Karen. So she says, what tips do you have for conversations with individuals depressed and stuck in their old pattern, for them to realize there are other possibilities, to recognize where they are and that there are other options they haven't considered, and to bring, or that can bring, a tiny bit of joy? So how do
Right.
we bring joy to folks who are stuck?
Right. And who are depressed. Sometimes it can be tough. I would say that, Karen, having a listening ear and being there for them will be very important. Stay connected with them. Ask the conversations about, how are you doing today? And, I understand this might be very challenging, but do know that I'm here for you. What is it that you need today that I can help you with? A lot of times, these individuals, because of the doom and gloom that this pandemic has brought to many, do find themselves stuck, and it's really hard to get out. And so, once again, I would encourage them to seek treatment. But for sure, don't give up on them. Continue to stay there and to stick in there. And I would also say, Karen, be mindful of engaging in your own self care practices to help you get through this time.
Yeah, I think that's really been a consistent theme, is making sure that you're taking care of yourself as
Yes.
much as you need to take care of other people. And I think we forget about that. We forget that we can't, we're no good to others if we're not here. So we have
Absolutely.
to be able to take care of ourselves and not view it as a selfish act, but really be able to, like you said, put our oxygen masks on
Yes.
first,
Yes.
absolutely. So this has really been a dynamic conversation. I thank you so much.
Thank you,
Um,
Carla.
so I always like to ask my guests, what are the top three things you would want to leave us with? So Dr. Bell, what are your top three things?
I would say number one, as we begin the process of reopening, that we, without a doubt, adhere to the CDC guidelines and those of our local and state authorities as it relates to physical health. I would say that make your mental health a priority in terms of self care that I talked about. Stay connected with others. You hear that over and over. You know, one of the longevity has a lot to do with socialization. So we're very social beings. So it's important that we stay connected with others. I would also say, number two, that we have to hold on to hope during this time. You know, in the midst of tragedy and loss and setbacks, we have to expect positive outcomes, that everything really will turn out better than what we're going through now. And I would say a part of that is, as individuals, we must do some introspection at this time. We're at a very pivotal point in time in our nation. And I think the change begins with ourselves individually in asking, you know, how am I a part of the solution or the problem? And then reaching out collectively to make a difference. And thirdly, but not, you know, least of all, most importantly, I would say, if you're having difficulty during this time in terms of, you know, managing anxiety, managing stress, you're finding yourself depressed because of the loss of a loved one or just the finances, I would say, you know, reach out, seek help today. And my motto is, when in doubt, get checked out.
Very, very good. Thank you so much. So, throughout our time today, we have been highlighting both the National Suicide Prevention Lifeline, and we have information there on the screen for you. If you know of anyone, or if you yourself are struggling, make sure that you reach out, as Dr. Bell has indicated. We also have the domestic violence hotline. This is a time where you really need to find a way to be safe for your children, to be safe for yourselves, and to move as far as you can into a safe environment. So thank you so much. I think we have another couple questions here. Oh, yes. So this is quite interesting. So Angelique says, how do you deal with people who may not be aware that they have a mental health issue?
Very, very challenging because a part of getting help is kind of recognizing that you need it. Um, but once again, I would say, you know, stay connected with the person and just express your concern. You know, mentioning Angelique, I'm concerned about you. It just seems like, you know, things have changed. You don't seem okay. You know, what is it that I can do to help you? I would say a lot of times too that for individuals, especially people of color, our first go-to is our primary care physicians. And so maybe, you know, being with that person and expressing, you know, speak with your primary care physician, your doctor about how you're feeling. But definitely, again, it can be challenging. Don't give up on the person and listen to them and be there for them and just kind of reiterate, you know, I'm very concerned about you. There is help out there.
Hmm. Good, good advice. Good advice, Dr. Bell. Thank you again for being with us, or being with me today. I
Thank you,
love this.
Carla.
I love this conversation that we're having. Um, I believe that we have to not only put an emphasis on how others are feeling, but
Yeah.
we have to really make sure that we are taking care of um, our own mental and emotional health. And I think, you know, it can be as simple as taking a bath. It can
Yes.
be as simple as, you know, going for a run, or just sitting out back and just sort of enjoying the breeze and the weather. We have to find ways to do that for ourselves. So
Yes.
thank you so much for this conversation. I
Thank you
really
again.
appreciate it. So I will
Yes,
see you soon. Thank
it's
you
been
so
a
much.
pleasure. Be well.
You too. So thank you all for joining us on Conversations with Carla. This has been a much needed conversation. And while this concludes our series on returning back to work, what we are going to do is continue the conversation. So we invite you to join us next week as we are back here again with Conversations with Carla. We will see you then. Have a great day.